Hi, I'm Jacqueline. I met you a couple months ago. I'd like to follow up on some of the topics that we discussed and review them with you. I'd like to try this audio version because some of you asked for a different format other than just paper. I will be sending a paper format as well along with this. I'm getting my information from several sources. One is from the 2019 CPT book. If your department does not have it, it's not that thick, you should consider asking your leadership for it. It's got all the guidelines and billing requirements as far as documentation in your chart notes of what's needed. So I will be referencing everything from the 2019 CPT manual. The second source of information is from Medi-Cal. Each of us can look up and go online and find out the reimbursement for each CPT code from Medi-Cal. This is what their website looks like. This is the actual reimbursements of the codes that we're going to be discussing today. Again, you can download it yourself and view it. Anyone can. It's public knowledge. The first code that we're going to discuss today, that we discussed a few months ago, is the Prolong service without direct patient being there in front of you, without you seeing them at first, so you're anticipating seeing them, or that you've seen them and this is follow-up time in relation to that service. The codes are 99358 and 99359. 99358 is for the 60 minutes that you spend either prior to seeing the patient, and they're for services in relation to what you're anticipating seeing the patient for, or for 60 minutes after you see the patient in relation to what you saw the patient for. So there has to be a face-to-face visit, either anticipated or that you saw the patient and then you're billing for time 60 minutes or more after you saw the patient. In the chart note, and again, the CPT book lists everything that needs to be in your chart note. You need to list the time, which is 60 minutes. You need to list what you actually did. So for that 60 minutes, did you review records? Did you talk to other consultants? Did you review tests? So you need to list what you did in order to bill. You cannot bill if it's under 60 minutes. It does not state specifically that you need to put a start and end time, although I will say it would be easier for auditing purposes if anyone ever questions you if you list a start and stop time, and that would be best practices if you could, as well as the tasks that you perform. So 99358 is for the 60 minutes. Medi-Cal pays $42.20 for that. The next code is 99359, and that's for an additional 30 minutes. So if you go beyond 60 minutes, it's a very complex patient, lots of items to review, lots of coordination of care, etc., then you would bill an additional 30 minutes. You do not have to only tack this on to patients where you've billed a 99215. It could be a patient that you billed a 99214, even 99213. Does not list that we have to use the highest level E&M code. And again, it's in relation to getting ready to see the patient or after you saw the patient, and all related to that patient care. This is what the information looks like in the CPT 2019 manual. The next code I'm going to discuss, and we talked briefly about, is Medical Team Conference, direct face-to-face contact with a patient and or family. Sometimes we confuse the code that I just discussed, which is spending more time meeting with colleagues to discuss a patient, their care, their medical records, coordination of care, medications, etc. Again, the past code that we discussed in relation to coming up to a visit, or so prior to a visit or right after post-visit. The medical team conference is for when there's 3 or more physicians or providers from different specialties that get together. Documentation, again, is listed in the CPT. You need to list who was present. Only one person from your specialty can report that code, and that pays $37.24. Again, at least 3 providers from different specialties. Needs to be documented, and needs to be at least 30 minutes or more of time with patient and family present. The next codes, there's 2 of them, is the chronic care management services, and we talked just briefly about that. That's also a time-based code, but this one's based on calendar month. So the first code is 99490, and that's based on at least 20 minutes of calendar time, 20 minutes of time in a calendar month. The patient needs to have at least 2 or more chronic conditions that they're expected to have at least for 12 months, and perhaps even death is expected. You need to have patient consent. You need to have a care management plan, and you need to document your time for the calendar month of at least 20 minutes. So it's a little bit different because it's based on a calendar month. So that is the first one, 99490. The second one, which is an additional code, would be for 30 minutes of physician or qualified professional time. Again, multiple chronic conditions, at least 2, and expected to have those conditions at least for 12 months or until death. And there needs to be a comprehensive plan put into place that discuss what you will be doing with that patient and how you'll be caring for them. And that one pays for Medi-Cal $71.19. I next will be sending you this week from the ICD-10 book, which is really thick. This is the 2019, the updates for hematology. So all the updates that occurred for 2019, I'll send you a cheat sheet for that. That takes a little bit longer because I have to actually look them up to make sure that a new digit hasn't been added. So I'll send that along this week. So with this video, you'll get all the information that I just discussed from the CPT book that will have the guidelines and the reimbursement. And I hope this helps a little bit explain what we discussed a few months ago. And I look forward to seeing you again. Thanks.